Just gonna stand there and watch me burn. But that's alright because
Broadcasting from the inner sanctum of human emotion, your radio just got personal. America's first competition talk show.
The hub is engaging.
Talk life.
Right now, though, there's something really that's making Karl Marx have a hissy fit. Roll over in his little grave because the cloud has descended upon his highest ideals for Europe. And Great Britain now has had their little experiment since 1948 with national HealthCare, the National HealthCare Service. It doesn't work, lo and behold. Imagine that. And so they are now determining that they're going to pull back, they're going to reverse history, they're going to roll it all back, and they are going to privatize healthcare. And if I'm Marx right now, I'm thinking that the poor little ruling class proletariat is going to have to take a back seat once again to the low-end bourgeois, the petty bourgeois, who are now going to have control over their own lives again. And if that is not the sign of a heartless, wretched, self-absorbed society, I don't know what is. The fact that they would believe that they could take care of themselves again. Jamie, I don't know where society gets off with this much self-absorption.
Well, my condition, my tumor, my lump is more important than yours, quite frankly.
Really?
That's basically what it boils down to. I would prefer if the doctor would be able to check out my rash. Your rash, sorry, you came behind me in line.
Well,
I used one of the 3 rash allocations that apparently they're going to utilize in the system. Actually, I don't know that they're privatizing it. What they're trying to do is to do a little more local control of governmental services.
It's
so it's
stuff.
this.
It's good.
It's they find that it's a little layered up over the years, so they want to cut some of that out and put the control over the care back in budgetary. Manipulation back in the hand of the general practitioners there.
Well, Barry, who's no longer wearing a face, you were a character last time. You're still a character. But here's the thing. They said up to this point that it's all been in flux. It's always been in flux, healthcare services and providing it in Britain, because the government was always searching for the best formula to cope with demand and the rising price and that type of thing. But so is health. It's always in flux. So it seems like it would cancel itself out after a while.
Well, I think the issue is they've been too centralized, and now they're just going 180 degrees and going ridiculous on being decentralized and letting the doctors do things that you probably should be centralized. So, I know I don't want the government being a proctologist and sticking their finger up. Well, never mind. But at the same time, do we really want individual doctors ordering tongue depressors rather than having that be done on a centralized basis?
Essentially, what they're talking about doing is shifting the management of your health care from England's what amounts to about $160 billion a year health budget, from the bureaucracy that's been put in place. They say somewhere close to 150 primary care trust entities that this new thing would basically dissolve, shifting it from that to back to the doctors. And so the doctors are determining what kind of care. General practitioners are contracting services from hospitals again, rather than these trust entities. And they're saying it's going to take about 100 to 125 billion of that 160 and transfer it back to control of general practitioners. Good or a bad thing? Or are these guys going to have to go out once again, Angelique, and learn how to manage their own business? God forbid they have to manage their own business.
I know. I think actually decentralization of bureaucracy is a good thing.
Unless you don't know how to manage your own business.
Unless you will have to get new managers in there, and they say that. The other part of it is, too, they said there's going to be a lot of job loss.
They're saying that. They're saying that, yeah.
Because
you are going to kill so much bureaucracy, and obviously job loss goes hand in hand with the loss of bureaucracy. So you're going to kill jobs here by putting this in place,
but
Jamie.
Cry
a river.
Well, it's on the one hand, you can't bemoan the loss of jobs that arguably the system would say are redundant. So the challenge is to say your job is one that has merit and value. Yours is the extra. So if there is bloat and inefficiency in the system where you can eliminate that, necessarily there are going to be some people who are going to be losing jobs and presumably being able to find a similar administrative extra Wouldn't that be a great thing to put on your resume?
Well,
my last position, I was totally extraneous.
Yeah.
I was superfluous to the operation of my business. I was the extra layer. If your business needs an extra layer, I'm the guy for the job.
But with all the extra time that I had on my hands, I learned how to be an integral part of the team you were hiring me to be a part of. I mean, it's the kind of thing where I had the time that all those workaholics did not have to actually analyze how best practices at work. So I'm better equipped for this than anybody else. What do you think, Jim?
I think there'll be, I don't know what the net job loss would be, but you're going to have people who know how to manage. There'll be a job increase for people who know how to manage a business, that someone could say, okay, I'll come in and run your practice for you day to day. I'll order the tongue depressors or the whatever, and let the doctors have time to be doctors. For me, I think the panic, the sheer panic that people are realizing in this is what happens when you have generations of dependency, that even a small change is seen as draconian because people have been lulled into this sense of dependence. And then when you change something over, they think the world's ending.
Well, but see, I mean, I can get the National Health Service, the efficiency that this would have had in a place like Great Britain, because you think about it, they're great at queuing. They have been forever. They understand the concept of first come, first serve. You never break in line. It's only failed for them a couple times in history. The American Revolution, the lines didn't really hold, and now this, apparently. Jamie, I will say this. I will say this. I mean, there's a quote here by the health secretary in Great Britain, Andrew Lansley, and he's saying that we need to put more power in the hands of patients now. He's saying that now care will be determined by, that up to now it's been determined by these entities, and that this plan will abolish that, and that's a good thing. I think if we could get a debate between him and Obama's healthcare czar, Donald Berwick, we'd have a good debate on our hands coming from a guy who says, that redistribution of wealth is inherently, by definition, what healthcare is all about. Angelique?
Well, you don't have the redistribution of health.
Well, the wealth of health.
I think what's funny about this is that they're talking about saving jobs, but then it's going to go to the doctors, and the doctors are going to have to run more things themselves, and they're talking about hiring consultants. So guess who they're going to hire as consultants? All these people that were redundant, that are getting laid off from the health providers, the centralized one, those are going to be your consultants helping the doctors run their practices. So basically, it's the same number of people. It'll be the same dollars. It'll just be moved around. There'll be more inefficiency.
I've read that. I found that the National Health Service was the world's fourth largest employer too. That's kind of scary.
Okay, see, you're getting rid of such a phenomenal employment agency.
Right.
They're like an employment agency unto themselves. So,
they're not saying that the national health care has failed. Right?
No, of course
they're simply saying that.
Just like socialism didn't fail, we just need a better socialist. We're working on that right now in this country.
Well, often the policy doesn't fail. It's the implementers that we have the problem with.
Yeah.
Here's what the challenge is. I read a great thing actually today that said, I intend to live forever. So far, so good. Right?
Was that God?
What's that?
Was that God?
It was actually one of the fat boys on Twitter.
Oh,
as a practical matter, that's where I think most doctors, have a hard time telling a patient no. So if the patient is there and says, won't you do this surgery? Why won't you do this procedure? I think it puts it in an awkward position to also be in control of the money and say,
from a technical perspective, Fat Boy can make that claim because once it's online, it does live forever.
And they say